from what we all have witnessed since these vaccines became available in December of 2020. They have made an enormous impact on countering the serious illness, hospitalization, and deaths from COVID-19 that gripped Maryland and the rest of the country before we had them. I want to emphasize that if you are one of the 1.3 million Marylanders who are now eligible for a booster shot, please get one. And if you're one of the 780,000 unvaccinated but eligible Marylanders, please get vaccinated. We have plenty of supply with vaccines on hand throughout the state. We have more than 960,000 Pfizer doses. We have more than 830,000 Moderna doses, and we have about 34,000 Johnson & Johnson doses. This is more than 1.8 million vaccine doses in the state. Please, if you're eligible, get your COVID-19 booster. We're ready for you. I'll stop there and turn it back to you, Governor. Thank you.
Thank you, Mr. Secretary. With that, we'll be happy to take some questions.
Governor, your advisor, Dr. Redfield, was on TV in the last few days saying that roughly 40% of the deaths in Maryland over the last 6 to 8 weeks were related to people who were fully vaccinated against COVID. A, is that number accurate, and is that number solely related to people with comorbidities?
No, the number was not quite accurate. It's somewhere closer to 30, I think just under 30%, not 40. But it's also because 86% of the people are vaccinated. So, and it is comorbidities for the most part. We have almost no cases of people without some kind of a comorbidity dying that are vaccinated. But what we're seeing is, there's less than 14% unvaccinated. When we get to 100% of people vaccinated, every single hospitalization and death will be people that have already been vaccinated but have waning immunity, that haven't gotten a booster. So it's less than 14% of the people are responsible for 70-some% of all the hospitalizations and deaths. The other 86% are responsible for a smaller, it's like an 80-20 rule.
Governor Hogan, is the booster a single dosage or is it a double dose like the initial vaccine?
I'll let maybe one of these guys.
It's a single dose, and the Moderna is half of what the original dose was, but Pfizer and J&J are one dose of the original formula.
Thank you.
You're welcome.
Mr. Strader, Dr. Chamberlain, I want to.
Either one, go ahead.
Either, go ahead.
In regards to what you mentioned, Governor, about the children who may be eligible soon, how will the planning of that look like? Will it be the schools, will it be community centers, will it be all different places?
Dr. Chen, why don't you take that?
Know what to prepare for.
Thank you so much for that question. So I guess in a word, yes, all of it, all of the above. What we have been working on over the last several weeks especially, but really over several months, is working very closely with our partners with the Maryland chapter of the American Academy of Pediatrics, with the Maryland chapter of the American Academy of Family Physicians, with our local health departments, pharmacies, and our school systems. We've had meetings with our local superintendents so that really we're trying to meet people where they are, as we have been throughout the vaccine campaign. And so doses will be available in pediatrician offices, primary care doctors' offices, local health departments who are partnering in most jurisdictions with the school systems, and they're in planning stages now, final planning stages of having school-based vaccine clinics for children. Pediatricians are gearing up. We continue to work very closely with them and have been talking to them weekly, really, for the last few months. So pharmacies as well. We know many pharmacies will be getting doses and are prepared to vaccinate children in that 5 to 11 age group.
Dr. Chen, you talked about meeting children where they are, and I know the Biden administration said they want pediatricians to sort of take the lead on vaccinating children. Given that the pandemic has sort of laid bare the inequities in the healthcare system, not every family has a primary care doctor, which means not every child has a pediatrician. What is the plan to meet those children where they are?
Well, this is exactly why we really have been working with our local health departments in partnership with school systems, because every child goes to school. And so we want to work with school systems to put those school-based vaccine clinics in the communities where they need them, so that children can get to them, so that parents may not, have to get them transported there if that's possible. So we're working very closely with them. In addition, I would say that we're still, the Vaccine Equity Task Force that the governor and the secretary mentioned is still working. And they're also being prepared to provide and work with communities for this vaccine rollout.
As far as storage, are all school systems prepared for the storage of those vaccines?
I'm sorry.
Are
if you-
all school systems prepared for storing those vaccines? The Pfizer, Moderna needing that extra cold storage?
So the school systems themselves are not vaccine providers. They are working in partnership with another provider. Typically, it's the local health department.
If I may, I have a very basic question about the vaccines for children. There's about 500,000, Governor, you said, who are eligible. Parents are very anxious and excited, and I feel like I just heard 500,000 hearts sing when you said there's only 180,000 doses that are coming. How is that? Is that first and second doses, as we saw with the initial rollout of the vaccine, or is that just first doses? Is that all you were allowed to order? I understand there's 15 million doses ready to go. That does not seem like a lot.
So it actually is a lot more than we ever got in one go, especially with the rollout last year. So we believe that, by getting that amount early on in the state will actually help get those initial groups of kids and the parents who want to get their kids vaccinated as soon as possible. What we are hearing from our federal partners is that that's obviously not going to be the only allocation that the state gets. We will be getting more in the weeks to come, and we'll be working very closely with providers to manage the first and second doses.
And just to be, I just need to be clear on this. So that's what you were allowed to order, or that's what was allocated to? And is this, have you been ordered, as we were in the beginning, this is for first and second doses? You know how you have to set the second dose aside?
Right.
Is that the same with this?
That's what we're working on right now. Again, as we get more information about exactly how many doses we'll be getting in the weeks to come, we'll be managing that closely with the providers. At this point in time, the federal government will not be setting aside a second dose allocation as they did early on in the vaccine rollout in December, January, et cetera. So we'll be working very closely with providers to make sure that individuals who got or get a first dose coming up also have a dose later for their second dose.
Couple quick questions. Before coming over here, I stopped at a place where people are getting vaccinated and just chatted to see what was on their mind. One question comes up from the J&J crowd. Gosh, how can I be the one that decides which of these three choices I get next? All right? So I don't know who wants to handle that, but do you have any guidance? I mean, we've all read that if you get a Moderna, your immunity rises higher than if you get the others, and J&J. So do you have any guidance to the J&J crowd who is now coming in saying, what should I do? That's question one.
So I would say get the dose that is most convenient for you. The most important thing is that they get boosted. 2 months after they receive their first dose, people, and this is regardless of whether they have an underlying medical condition or regardless of age, anyone who got a Johnson & Johnson vaccine 2 months or more ago should be looking for a booster of any kind. We have, as the secretary indicated in his numbers, a much larger supply of Pfizer and of Moderna in the state, and that's because of manufacturing and other supply issues. And so I would say look for the booster that's most accessible to you. We don't have a specific recommendation.
So in particular, the lady I spoke to said, I didn't want the Johnson & Johnson, but they said get the one that's first available to you. And now you're saying the same thing. You're unwilling to provide any advice about getting one or the other at this point?
I think at this point, when we look at the Johnson & Johnson data, and, for any vaccine, it is still protective against hospitalizations and death. And as we've been reiterating, and the governor has said, and that is still our topmost priority, is prevent, complications from COVID infection. And so if she can find a Pfizer or Moderna dose in her vicinity, we would advise that she get it, or if it's a Johnson & Johnson, it is just a smaller supply in the state.
And then the other thing is the spirit, it's probably for the governor. At this place where we went, they were actually turning some folks away who came in and said, hey, I'm 6 months past, and, I think it's my turn, and I feel vulnerable and I want it. Do you not want that to happen?
Maybe I'll let Secretary Schrader address that.
Well, one, I'd love if you could refer that person. We believe we have plenty of vaccine, and we're monitoring the situation. If somebody feels that they want it, they're not getting it, you should just call our call center and we'll take care of it immediately. There's plenty of vaccine, and we'll get them an appointment.
Mr. Secretary, I have one point I want to make sure I was clear on, the comorbidity. If somebody has two of those, any two of those, obesity, high blood pressure, whatever the case may be, then technically in Maryland, they're eligible, they can go now and get.
Yes.
Any one of them.
Any one of them, any one of them, right.
1.4 million that we said are eligible right now.
That includes them. Yes, that includes anybody who has one or more comorbidities is in that 1.4 million, and they're eligible today.
Mr. Secretary, in terms of the child vaccines, going back to that, as soon as all of the approvals come through, how long will it be until we start seeing shots going to children's hospitals? Will it be weeks later? Will it be
We're planning to start immediately. They are positioning the vaccine, which is why we've already ordered it. And so as soon as it gets here, we'll be ready, and as Dr. Chan, we've been talking to all the providers to get ready to roll. So we want to start immediately.
potentially early November?
Same
Day that they get the approval.
Whatever, yeah.
Is it here in our state yet?
Not yet, but we expect it to arrive very soon. We made the initial orders last week.
And again, is the 180,000 what you were allowed to order, is that the maximum, or what we decided?
No, we ordered everything that we could get, and we wanted it here. And we used some modeling curves based on the 12 to 15, which said that there was an early surge, and then it flattened out. And our numbers suggest that 180,000 will serve us well to get off to a very fast start.
Last question?
Governor, quick question, please. Sure. In terms of some of our Marylanders who are unvaccinated, there's some members of local FOPs, state FOPs who have not been. Are you going to at least encourage them that they should receive vaccination?
We've been encouraging every single person for 11 months to get vaccinated, so we're going to continue to do that, absolutely. Yeah. Thank you.